Good evening, everyone. The topic of our paper presentation today is sleep apnea and gerodontology, a comprehensive approach for senior care. So, as we all know, that sleep apnea is a quite serious condition that is affecting millions of older adults, wherein breathing stops repeatedly as well as starts during the sleep. Now, the risk of apnea keeps on increasing with advancing age, and thereby it impacts the overall health as well as the quality of life. Now, gerodontologists are crucial, how? Because they help in identifying as well as treating sleep apnea using custom-made oral appliances that provide a non-invasive and effective solutions. Now, according to apnea hypopnea index, it can be classified from mild to severe form based on the scoring from less than 50 to more than 30. Now, it is classified into two types. One is obstructive and another is centrally mediated. So, in obstructive sleep apnea, it is more common of the two form and is commonly seen in the geriatric population. It is mainly characterized by repetitive episodes of complete or partial upper airway blockade during sleep. Now, as we can say that in normal airway, the passageway ridge is open and there is a continuous unobstructed airflow from the nasopharynx towards the oropharynx. But however, in case of sleep apnea, due to the flaccidity or laxity of muscle with advancing age, the soft palate drops back and completely contact with the posterior pharyngeal wall, thereby resulting in the obstruction of airflow. Second is centrally mediated sleep apnea, wherein the airway is not blocked but the brain fails to signal the muscles to breathe. Why? Due to the instability in the respiratory control center due to certain pathologies like stroke or myotrophic lateral sclerosis. In between the obstructed and the central sleep apnea, there lies a third complex that is the mixed or the complex sleep apnea. According to a survey that was done by United States of America, the prevalence of the obstructive sleep apnea it rapidly increased with advancing age, chiefly seen between 45 to 65 years of age, and amongst gender it is commonly seen in females as compared to males. Also, if we talk about the symptom, that is generally seen that the symptoms are more worse during the nighttime as compared to the daytime, wherein the patient has loud, persistent snoring and witnesses multiple pause in breathing. There is choking or gasping of air, as well as restlessness in the sleep. While daytime symptom it includes early morning headaches, daytime sleepiness, poor concentration, irritability. Now, diagnosis it mainly requires a thorough clinical examination as well as history taking, and the most reliable indicator being the relative, that help in telling about the history of repetitive episodes of snoring or obstructive breathing. Also, physical examination of the oropharyngeal structure is important to check for any growth, neoplasm, or other muscular disorders. The gold standard among all is the polysomnography test. And apart from it, there are multiple modalities like oxyhemoglobin saturation, chest wall effort, segmental EMG, blood gas evaluation, fiber optic nasopharyngoscopy, etc. Now, management. Management can be classified into two types: medical management and surgical management. According to the medical management, it firstly required waist load exercises, continuous positive air pressure management, pharmacological agents like modafinil, and oral appliances that are mainly concerned with the gerodontologist. Surgical method mainly includes oropharyngeal surgery like distraction osteogenesis, mandibular advancement, or nasal surgery include adenoid surgery, septal deviation surgery, or nasal surgeries, etc. Now, if we talk about the prosthodontist approach, firstly we have an mandibular advancement appliance. So these appliances mainly help in movement of the mandible in a more forward position that thereby helps in increasing the patency of the airway as well as keeping the musculature in a more taut position and prevent its collapse during sleep. Second is the tongue retaining devices that helps in holding a tongue again in a forward position, which further tauts the muscle of the soft palate and helps in the airway being open during sleep, and also prevents the tongue from falling backward, thereby reducing the risk of airway obstruction. Third is palatal lift devices. These are devices that are generally used to treat conditions such as velopharyngeal insufficiency. They mainly work by physically lifting the soft palatal velum towards the posterior pharyngeal wall and thereby obtaining a proper closure of the seal of the velopharyngeal port. Now, there are certain advantages of sleep apnea devices as compared to various medical or other surgical modalities. Firstly, it helps in it is a mainly a non-invasive procedure if we compare it with comparison to devices such as your CPAP. Also, these are quite portable and convenient, being small in size, lightweight, and easy to travel. They have an increased comfort because patients often find it difficult to wear a CPAP mask for a longer duration of time. They do not make noise like large machines such as CPAP, and it has patient often the reports of better compliance. But if I talk about the disadvantages, these are less effective for severe cases and can be used for only mild to moderate cases. Patient often complains of jaw discomfort, pain, as well as TMJ problem due to prolonged use. Dental side effects are often seen like a bite change in bite alignment or tooth movement, and patient often require regular adjustment, and this may not be often covered in the insurance. Now, regarding complete denture as a mandibular advancement appliance, it is a systematic review that was conducted by Preetha Krishnamurthy et al., wherein the study about the impact of complete denture mandibular advancement devices in management of completely edentulous obstructive sleep apneic patient. Now, in herein, they basically observed that in patients who have complete edentulism, the changes in the anatomy of upper airway during sleep are seen, and they influence the postural rest position of mandible, the tongue, and the muscular tone. And there is a decrease in the occlusal vertical dimension following loss of teeth, which further results in reduction of the lower facial height, rotation of mandible with a reduction in the airway space. So, therefore, what they did was they fabricated a maxillary and mandibular complete dentures, and the with the maxillary denture in patient mouth, the phasebow record was transferred in a Hanau wide view articulator. A 3 mm thick wax intraocclusal record was made, and the maximum protrusive jaw movement was done, which was further dictated by the condylar guidance path of the patient. Then these mandibular dentures were mounted on the articular using the wax record. These wax record were then converted into a heat cure soft liner, as we can see here. Then, after fabrication of these soft liners, hole was drilled in the first molar region in the intaglio surface of the maxillary denture bilaterally, which passed through this wafer up to the occlusal surface of the mandibular denture. Now, it was done so that these can be joined together using the help of brass screws that pass through both of these holes. So, therefore, when the patient when the patient sleeps at night time, he has repetitive episodes of apnea. So, this protrusion of the mandibular audit advancement helps in tauting the musculature of the soft palate and thereby preventing its drooping. And when they did a follow-up for a period of 15 months, they observed that there was an improvement in the baseline AHI index for the post-treatment AHI. The reviews as well as literature regarding this method is limited, and further studies need to be conducted, but a fruitful could be a potential method to improve the symptoms of the sleep apnea in completely edentulous patients. And at last, I would like to conclude that effective management of sleep apnea in older adults require a multidisciplinary approach, including medical and surgical intervention. Early diagnostic, customized treatment are very crucial in improving the overall quality of sleep. Complete denture can be effectively utilized as a mandibular advancement device because these are a non-abrasive approach for airway patency and hence help in enhancing the sleep quality and improving the apnea symptoms, therefore offering a practical solution for geriatric care. These are my references. Thank you.